Hey everybody, Rob Palumbo here. I wanted to catch you guys up on something that I've been a little hesitant to do for some time here. Part of it has been, I've been waiting to see how things turn out, and part of it is I never wanted to really admit it to myself. One of the things I always tell my athletes is I never want them for me to be their ghost of Christmas future. And I would explain that to them because now I played football in college, D1 football in college, started for 3 years, and kind of paying the price for it now. Um, and I try to explain to a lot of my younger athletes that, you know, if you don't take care of your injuries well enough, you can actually could lead to some real bad things. And it doesn't, not for everybody, but certainly for myself and a lot of friends that I have in the same position I'm in. Um, some are worse, some are better, and it's self inflicted, no doubt. But it was self inflicted by a you know 18 to 22-year old kid whose mindset was a little different than it is as a 60-year-old old man. Um, what I'm talking about is the multiple injuries and the multiple surgeries that I've had during the time I played and since I played college football. Um, I have had about 17 or 18 procedures, surgical procedures. Uh, one while I played, one while I played, and then the rest since. I've been left with a total hip replacement, two partial knee replacements. My back is fused from L2 to S1, and my neck is fused from L5. I'm sorry, C5 to T1, and the rest of it doesn't look that good either. I've been spending a lot of time trying to just keep myself going at this point. Unfortunately, about 3 years ago, the cervical problems became a real issue. I've had prior to that, I had two different cervical surgeries, both fusions, but limited from the front. Unfortunately, over a period of time, I started developing some significant problems with pain, but almost more importantly, problems with dexterity in my fingers and balance in my feet. Um, I remember towards the time I really opened my eyes, I there was a lot of instruments being dropped in the OR, and at one point I just talked to my surgical tech and I said, "Hey, put the things in my hand." And he just kind of looked at me, kind of like, you know, uh, sorry, boss, I'm trying. And my PA, who's a very close friend as well, been with me for 17 years, um, brought me into the doctor's lounge. Said, "Doc, he's putting things in your hand. Things are just falling out." And at that point, we did a neurologic exam, and I wasn't very good. And from that time, which was probably early to mid December of 2016 till January of 2016, my pain got significantly worse and my dexterity got significantly worse. And this continued. Fortunately, had I usually January is a month where I do a lot of traveling, a lot of educational stuff, and so I wasn't set to do much at that time. So I spent a lot of time starting to evaluate what was going on. I had a functional capacity evaluation of my hands and my feet and my strength and my balance, and it was not good, and it was getting worse. Um, they weren't sure at first whether it was neurologic from my brain or other things going on, but I did have had an MRI that showed some real bad damage to the central part of my spinal cord between my C5 and C7 vertebrae, and it was in the central part, which is a real important part for signaling going back and forth for balance and such. Well, over the next month or two, things continued to get worse and worse. I got to the point where I almost couldn't hold a fork, and I was tripping and certainly couldn't walk in the dark, and had trouble going up and down steps, and had to hold on things, was using assisted devices, and finally, after uh, several consultations, I found this great doctor, Dr. Daniel Rue at Columbia in New York City, who basically designed the procedure that a lot of people were talking to me about, and so I had, well, it's essentially at that time surgery from C3 to T1, doing a lot of work in the areas that weren't fused and fusing the areas that were fused, and um, but I've always come back from surgery. Um, After my spine fusions, I was back within the longest was 4 weeks. After my bilateral knee surgery, same thing. My hip surgery, well, that's another story. We'll talk another day. But I was dancing in a week later. Um, Paid for that. But so after the surgery, things didn't get better for a real long time, and gradually, certainly the pain um, from the pinched nerves was much improved, but my function um, didn't come back, and I kept waiting and waiting, and things got better. I mean, at one point, there's no way I could have held a syringe and given a shot. At another point, and that got better, and then I started being able to do some things with my hand. I started playing drums a little bit and my guitar a little bit, which I couldn't do. Still can't very well, but better. Um, but the fine motor skills were still taking a long time. But still, I thought it's going to come back. It's going to come back. It's going to come back. And here we are, about 3 years later, and it came back to a point, but never to the point where I felt comfortable doing surgery. Um, I have the fortune to assist some of my partners and stuff, and there's usually some type of a time limit I could work before my hands go numb or things like that. Um, but I always said there's no way I would ever operate until I would operate on my sons. And I'm certainly not there yet. And it's been 3 years, and my surgeon always said, well, you gotta wait that 18 months to 2 years, and we'll see how you are at that point. And it's still not to the point where I could do surgery. And there's a lot of days where the pain's too much, where it's even hard for me to see patients. So I keep working through it. I keep doing what I can. I'm paying for the fact that and some of my patients will know this, I'm paying for the fact that I always said that pain is a perception. and and yeah, I'm perceiving a lot, but it is, you try to take away the emotional response from the pain, and you can deal with it usually. The hardest thing, though, is you've defined yourself as a pretty active guy, and certainly a surgeon, and being pretty high level with the patients and the athletes that I've taken care of over the years, and losing that has been incredibly hard, um, incredibly hard. And so I'm trying to get back to what would be a chapter two or near normal, new normal. Still having trouble figuring that out. Um, Love treating athletes, love being around athletes. Favorite place to be is in the training room. Because I still got a lot of knowledge to help me take care of people and teach. Um, but it's nowhere being the same. So um, I've decided that my next step is to um, possibly go through a stem cell treatment. And the treatment I'm talking about, probably, well, the degree I'm talking about, unfortunately, isn't available in the United States. Um, the, um, the techniques are either investigational in the United States or not allowed in the United States, because we can't manipulate cells in the United States when we do stem cell, which we do in our office all the time. But I've always said that what we're doing in the United States compared to what they're doing elsewhere is still stem cell light, and that is bothersome to me. Um, that's hard. But we still do, and we still get some good results, especially when it comes to arthritis and tendinopathies and things like that. But the neurologic stuff is a little different, and so I'm probably going to be, as soon as the virus allows me to travel and those kind of things, I'll be going to BioAccelerator in Colombia, Medellin, Colombia. It's a clinic that I've worked with. I've sent athletes to. They use placenta-derived stem cells that they could actually culture and grow, and they know exactly how much they're giving. I've talked to some of the neurosurgeons there about injecting into my spinal column and going through different areas, injecting within the disc areas too of the discs that I have remaining, and some other ways of doing it. And what I guess I'm saying is this will be day one or day not of a journey that I want you guys to come with me. So we'll be talking a lot about this. A lot of you have seen some of my biologics talks in the past. I'll be posting some of those things about my beliefs and about why I think things work. And but I figure it's time for me to talk. It's going to start with actually one of my partners giving me a series of exosome treatments, which is the extracellular signaling cells that are within stem cells, and actually these are produced from placental derived products, and they're going to be injecting into my elbow, which is severely arthritic as well. That's going to be the start, but as far as the neurologic and spinal stuff, that's going to be a little later on once I could travel back and forth to Colombia. So I'll keep you up to date. Wish me luck. It's hard when you see you can't define yourself anymore as what you once were, but certainly I want to give myself as much chance to get as functional as I can, even for my activities of daily living. I want to be able to walk through a room with the lights off without tripping, and not having to look down when I'm going up and down steps so I don't miss one. So I'm hoping you all will follow with me. Certainly, leave comments of any of you guys that have gone through similar things, and any questions you may have. I'll try to answer them as we go. But like I said, this is day one, so or day not, and hopefully talk to you soon. So have a great day, everybody, and look forward to doing a lot of these that aren't focused around me. But also the ones that will follow me through this little adventure. So thanks for watching, and please comment, and look forward to taking this journey.